There.
Jonah, patient assessment trauma.
Okay.
You have 10 minutes to complete this skill sheet, sir.
Okay.
You are dispatched to outside Dirty Ernie's bar for a bar fight.
Okay.
Police is on scene.
All right. BSI, is my scene safe?
Yep.
Do I have any additional information for this patient at this time?
Cops say he got beat up
Okay.
and he's laying on the sidewalk.
All right. My MOI right now is that my patient has been assaulted and beat up. Is this my only patient?
Yes.
Okay. I'm going to call additional resources if I need to, always having C-spine precautions in mind.
Okay. You find him laying on the sidewalk. He's all bruised up. Shirt's been ripped. You notice maybe a couple shoe marks on his chest.
Okay.
And he's laying on the sidewalk.
All right. That's the general impression for my patient is unresponsive, laying on the sidewalk, been beat up, shoe marks on his chest. Any level of consciousness, anything when I try to arouse him?
Unresponsive.
Okay. GCS of 3 right now. A&O times 0. Any threatening life injuries at this time?
You don't notice any major bleeding or anything.
Any major bleeding? Okay. All right. My patient's chief complaint at this time as well is just unresponsive, beat up. I'm going to check his airway as well. Do I have anything for his airway? Is it patent?
He's unresponsive, so no.
Okay. I'm going to have one of my partners open up his airway and assess it. Looking into his airway, do I see anything?
No.
Okay. His breathing right now, any breathing?
He is not breathing.
He's not breathing. I'm going to have another partner start BVM, bagging this patient, giving him ventilations. My ventilations right now are going to be 12 to 20 per minute. I'm going to check circulation, check a pulse.
He has a pulse. He has a pulse of 100.
Okay. Rate, rhythm, quality for that pulse?
It's regular.
Regular? Okay. And then for my skin signs for perfusion, anything there?
No.
No? Okay.
Unremarkable.
All right. Just because of him being GCS of 3, I'm going to start getting him loaded and going to my nearest hospital as well. Always take into consideration my C-spine, backboard if needed, whatever I'll need for that. I'm going to go ahead into my assessment as well, having my partners immediately getting some vital signs for me as well, blood pressure, pulse, respirations, my quality of respirations, oxygen, if I need oxygen right now, which I will have 15 liters if I'm bagging my patient, for my BVM, just all the different things I need, blood pressure, BGL, all that kind of stuff, and title as well. So I'm going to start with my secondary assessment. I'm going to be checking his skull for bleeding, decap, BTLS, anything.
You don't have any bleeding, but he has a goose egg on his head.
Okay.
On the right side.
On the right side? Okay.
Yep.
Anything on the posterior portion of the head?
No, that's clear.
How are my eyes? Are they pearl?
Yeah, they are pearl.
Anything for my ears? Any haloing?
No.
Bleeding?
Ears are
decap,
clear.
BTLS. Okay. Nose?
Nose is clear.
Any more secretions in the mouth? Anything like that?
Yeah, he has some spit in there.
Okay.
Maybe your partner's reporting a harder time bagging.
Some resistance. Okay, I'm going to suction my patient as well. Using oral adjunct. I'm actually going to do just dual NPAs this time too.
Dual NPAs.
I'm going to be checking his cervical spine as well for step-offs.
No step-off.
Decap, BTLS. How about JVD, tracheal deviation?
He does have tracheal deviation.
Okay.
And JVD.
All right. I'm going to just take those into consideration right now. Checking down his chest, I'm going to listen to lung sounds, check for any decap, BTLS, fail, segment pieces.
You hear absent lung sounds and diminished lung sounds.
Okay, which side are the absent?
On the left, where you see the shoe mark.
Okay, absent on the left, diminished on the right. Take that into consideration as well. Start checking down the rest of his abdomen, anything, decap, BTLS.
You notice a bruise on his left lower quadrant.
Okay. Anything for his legs, feeling pulses, CMS, decap, BTLS?
Those are clear.
Clear, okay. Anything for the arms as well?
Clear.
I'm going to also rotate this patient so I can check his spine as well in the back of this patient.
Clear.
Clear? Okay. I'm going to get this patient loaded into the ambulance. Some more vital signs going as well. I'm going to chest start this patient as well. I'm going to go second intercostal space, mid-clavicular with a 14 gauge dart. I'm going to administer that on the left side.
Okay. You're a rush of air.
Rush of air, okay.
Your partner now says that bagging has gotten a lot easier, and the patient tries to start breathing on his own.
Tries to start breathing on his own. Has his GCS improved?
Not yet.
Not yet? Okay. I'm going to still just assist ventilations as needed, keeping 15 liters per minute of oxygen going. I'm going to have bilateral large bore IV started on either side of the arm. What do the rest of my vital signs look like at this time?
120/80 for blood pressure, pulse is 100.
Okay.
Respirations are assisted.
Okay. Is my SpO2 still reading good?
Yeah, he's
Okay.
100%.
All right, I'm going to just reassess this patient every 5 minutes. It was load and go. Going to get him to the nearest hospital, reassess my interventions and my vitals.
Okay, anything else you'd like to add?
Not at this time, no.